All right, my friends. Thank you so much for taking the time today. I want to also welcome those that are joining us via Zoom and Facebook. My name is Josiah Gilliam. I am the My Brother's Keeper coordinator for the city of Pittsburgh and Allegheny County through the mayor's office, Bill Peduto. And we're going to take this chance to begin a series of conversations that explores the realities of COVID-19 here in Pittsburgh through the different buckets of activity in the mayor's office, as well as other resources that are available for our neighbors. And so to begin with, I'd like to take the chance to allow the team here to introduce themselves and their role within the office, starting with Mayor of Pittsburgh, Bill Peduto.
Thanks, Josiah. I'm Bill Peduto, the mayor of the city of Pittsburgh. We established the Office of Equity within the mayor's office in order to be able to create a filter of equity for all of the operations of city government, whether that is in providing services to at-risk groups or simply changing our streetlights. Equity comes in all forms of how we deliver services, and I rely upon this team that you'll meet and get to know today in order to provide that direction for the city of Pittsburgh.
Thank you, Mayor. Deputy Chief Majestic.
Yes, Majestic Lane, Chief Equity Officer and Deputy Chief of Staff for Mayor Peduto. And my role is to work, with the leadership of the mayor and the leadership of the administration. Like the mayor said, to make sure that equity is embedded in all things that we do within government, thinking about things that matter to people, being people-centered, and also, shining a light on things in populations and communities that traditionally maybe have not received the attention from local government, state government, federal government, and everything. Just making sure that we're being as people-centered as we can for all the residents of our city.
Thank you, sir. And Assistant Chief Lindsay.
Hi, everyone. Good afternoon. My name is Lindsay Powell. I serve as the Assistant Chief of Staff, and I run the Legislative and Policy Shop. So anything that comes from the mayor's office at the local, state, or federal level, we have a fantastic team embedded within the Office of Equity that helps the administration make decisions on how to move forward and create a more equitable Pittsburgh.
Thank you so much. We also want to acknowledge we will have two ASL interpreters for us with us in the conversation. We thank them for their time. Mayor Peduto, I'd like to just start with you, and I will begin the conversation with each of you on a personal level. How are you doing, Mayor? And how would you express that to the neighbors that are watching?
Doing well. I think one of the things that will be a takeaway from today is the team approach that we have moved towards within city government. And whether we're working together in an office or working separately through our homes, we haven't missed a beat. So on a personal level, like most people, I find myself at certain times bored and wanting to go back to what we all expected to be normal life, but also realizing that we control our own destiny and we have the ability to assure that Pittsburgh and Western Pennsylvania is not overtaken by this virus.
So let's keep it right there, Mr. Mayor. How have you and the administration crafted the city's approach to COVID based on available information as it's become available and the examples from other cities?
It's very fluid. And the example you said with other cities is something that's becoming much more prevalent in the last couple of weeks. Have had numerous conversations this week with other mayors trying to get a handle on not only what they are doing to prevent the virus from spreading, but what are the different methods that they're using data in order to be able to get back to what we would call normal. Our approach to this from the very beginning has always been based off of the advice of medical experts. And we started back in February. Actually, Public Safety Director Histrick began in January. We began full operations in February working with the Center for Disease Control and the National Institute of Health. Since that time, we've expanded it to involve also the World Health Organization, to learn from cities in other continents. So yeah, I would say that the best way to describe operationally how the city has been able to function is that it's been a fluid operation that we have been working with others to try and get the best practices implemented right here at home.
Thank you. So can you speak to how in Western Pennsylvania we have a somewhat of a unique setup? Can you speak to the realities just within Allegheny County of working with other partners like the county executive's office and the health department to help get some clarity in the midst of this fluidity?
Well, I think that it speaks volumes to the necessity of having a mayor and a county executive who are able to work together very closely. Obviously, we rely upon the county and the county health department for a lot of that advice that we're getting. And that cooperation then comes back to us in providing the on-ground services through public safety and other types of operations to be able to continue to allow this region to be able to not only survive the virus, but having a plan to get out from the conditions we're under presently. That relationship goes up the chain to the governor in communication with the governor, his office, and our lieutenant governor, and then to our federal officials. So there has been an all hands on deck approach from the very beginning that's been based off of the ability for local government to work with county government, to work with state government, and to reach out to our federal officials.
So then let's zoom back in. How have you approached how our city government meets the needs of our individual communities and our individual neighbors? And what does that tell us about the role of city government in everyday life?
It's a bottom-up approach. So our office has been in touch with all of our community organizations, our nonprofit community, working specifically, and as we start talking more about equity in the equation, to those that are in marginalized communities. So whenever you have the normal day by day, there are going to be parts of our community that are under stress. And that could be our homeless community, that could be veterans, that could be those that suffer from addiction, that could be those through gender identification, find themselves not getting their legal rights. All of these different groups, and especially children, the hungry seniors, whenever you add a shock like a global pandemic, they become the ones that become the most affected. It affects them in a way that becomes life or death. It affects them in a way that allows them to be able to operate or not operate on a daily basis. So by reaching out to those different groups, realizing where the needs are in order to be able to get through this crisis, we're able to provide an extra layer of support that may have been created where the safety net has some pretty big holes in it. But this will never be something that local government can do by itself. In fact, local government is more a function of filling potholes, picking up garbage, and providing public safety than it is a social service or a human service agency. So what we do is we provide a way to bring others to the table, whether it's our corporate leaders, as you have seen recently with the tech community standing up to make sure that all of our children have a laptop, whether it is small businesses like our restaurants, who have stepped up in order to make sure that nobody is hungry, or whether it's our foundations, our large nonprofit institutions, and those nonprofits on the ground. We provide a means to pull the city together, not allow it to get torn apart, and to be able to provide that critical service.
You mentioned how you've been having conversations with other mayors and the importance of equity. As we look at other regions in the nation and certainly around the world, some pretty clear racial disparities have emerged in terms of contact with the virus and deaths. Given, to your point, that local government can convene all of these stakeholders, what does a new normal look like from your perspective, and how do we move in that direction?
Well, I think that if you asked anybody who would work in public health, they would not be surprised by the racial disparity that's been seen on a national basis based upon the number of fatalities and those being infected, primarily in African American urban areas. A combination between density and the fact that we have already had disparity in the provision of healthcare are two factors that are directly associated with the contraction of the virus. And when your health system is weak because of an inability to get appropriate care, you're more likely to have a fatal conclusion to the virus. So this shouldn't be a surprise. We should realize that this is built into the system that we presently have. So we have to change the system. What we've been doing in Pittsburgh is really relying a lot on telemedicine. And we have been very successful, especially within our homeless community, where folks who never had access to a doctor are now able to go to a shelter where a nurse is there and they're talking to the doctor just like we're talking right now. They're able to get a prescription from that conversation and are able to walk down the street and get the medicine that they need. We've expanded that with our EMS operations and being able to have doctors so that we can provide that type of care in somebody's home when our medics are arriving. Imagine the ability of having a doctor arriving in your home. What we want to see is the expansion of this and the expansion of it through more children and family services and being able to provide medical, both physical and mental medical assistance to those that need it as simple as we're having this conversation today.
It's an encouraging note. One last question about a new normal. So before the call, we were talking about the last time Pittsburgh faced a pandemic in the Spanish flu and the response or perhaps lack thereof of officials back then, and how Mayor Babcock approached things. And one of the commonalities with what we see today was the reality of air quality and other external factors that put people at a heightened risk for coming in contact with that disease. When you think about the new normal, just in general, how should we be informed by that history, and what would that new normal look like as it relates to environmental justice?
Yeah, it's a sad note in Pittsburgh history that during the Spanish flu, Pittsburgh and Philadelphia were two of the worst cities in being able to address the pandemic. In fact, Pittsburgh decided to reopen, to allow churches to reopen, to have large events. I believe it was in Philadelphia where they had like a victory parade that was directly responsible for the deaths of so many people. And what we saw was the second wave of the pandemic, which we're predicting is going to happen as well, was worse than the first. And not only that, but much worse, causing the deaths, needless deaths of so many people, simply because we did not heed the advice of the medical experts. If you look like a city like St. Louis that did, the number of deaths were minimal. because of there were no lessons to be learned, but because of the advice that city leaders were taking. So those who refuse to learn from history are doomed to repeat it. We don't want to be in that situation. We announced today that many of our outdoor workers will be going back to work as soon as tomorrow. But even in that, we're following the CDC's strict guidelines, and we are putting workers on shifts in order to minimize any gathering of workers, understanding that outside can be as dangerous as inside.
Thank you, Mayor. I want to acknowledge our community that's been participating on the call and submitting questions. One here, Mr. Mayor, and anyone can weigh in if there's any information on this. The question is related to the availability of vaccines should it become available. Who would be managing that? Would that be a city, county, state, or federal thing? And as far as you know,
so we're far away from a vaccine, and I just don't want to give anybody false hope and assuming that we're going to be able to have a vaccine readily available and this will just go away. It's going to take time. The CDC has provided us with the information that we will not see a vaccine until at the earliest the end of the year. What I would look at is the testing protocol that we have right now. We don't have national health care. I think this is a good time to start having that conversation. In other countries around the world where there is national health care, testing is readily available, and it is done on a national basis. In our country, it is being done on a national basis, on a local basis, and even at a statewide basis, but it's not being done in any holistic way. I don't think that we can simply rely on the federal government to test. So we've been encouraging Allegheny Health Network and UPMC to expand their testing for our residents and for this region. I think we'll be seeing the same thing with vaccinations, but it's very likely that vaccinations will not come from hospitals or clinics, but from a corporation. And in that, we have to make sure that vaccinations then will be readily available and affordable or free.
Thank you, Mr. Mayor. Majestic, let's bring you into the conversation. You are the Deputy Chief of Staff and also the Chief Equity Officer, the first in Pittsburgh's history. How are you doing today?
I'm pretty good, and thank you, Josiah, and thank you, Mayor, for being open and willing and ready to have this real conversation and the conversation that's on the minds of many people. So it's great that we can have this dialogue. And I'm good. I'm good. Really thinking about those who are faring in different situations and how can we work to help those who do find themselves faring in different situations as I am.
Yes, sir. Well, let's just jump right to it. So there are a number of initiatives within the Office of Equity. How has the team approached engaging with communities during this time, and how have you been able to set priorities while so much is changing?
Yeah, I think we've been really looking at, there are a lot of people who are affected in a lot of different ways. And as the mayor said, we know that there's a lot of people who are suffering from the social determinants of health, who are negatively impacted from the social determinants of health in our normal society, right? And I put those in air quotes. And so we know now, given that we have a global pandemic, it's exacerbating the challenges that we've already seen. So we've had to really look at the layers and the intersections of identities and realities for people, and then looking at how can we get resources to people, how can we partner where it's applicable, like the mayor said, really using that convening power to identify where the opportunities are to bring folks together, and then to speed up the access, speed up the process, or in some ways to set standards The administration and the mayor were really early on, social distancing and physical distancing, really talking about the shifts that we would have to make. I would say that was prescient and important in us really looking at where we are today. But I think the role of government in that context is how do you set a standard for really thinking about the health, safety, and welfare of every citizen.
Thank you for that. Let's zoom out very briefly. You mentioned this idea of social determinants and also this idea of setting new standards. In looking at the national landscape, how is the conversation on equity shifting, and where does it need to go if we are to define and execute on those new standards?
Yeah, well, I think, as the mayor touched upon, and I think as most people know, have seen in the news, the reality of the impact of COVID-19 on the African-American community, on the Latino community, on the Native American community, has been startling, and it has been outsized in its impact. And much of that is due to the social determinants of health and the things that were going on at prior, and to say nothing of some of the challenges of the economic challenges that were occurring that led to some of the health challenges because of many people in the service industry who then found themselves getting sick as well and contracting COVID on top of some of the other challenges that they had. So I think the national conversation has shined a light on the things that were happening previously that we took as normal. We accepted asthma in Black and brown communities. We accepted the prevalence of diabetes in poor and rural communities. We accepted the presence of lung diseases and lung challenges in Native communities. And so now we see that when we have another challenge that's laid upon that, we see what's happening. We see people are dying. We see people are out of work. We see a lot of people who are without addresses and the homeless now shifting in other cities to living on the subways. So we're seeing just a lot of the challenges laid bare when we are stopping to take a look. And I think that this challenge has made us stop to take a look. And when we take the look now, it's what do we do with the look? And how does everyone play their role in looking at that? I will say for us, it's really part of the conversations have been acknowledging the disparities that have occurred in Allegheny County. While we haven't seen the same disparities as far as health outcomes in the African American community, I think everyone is really interested in making sure that there's more testing done. So just really looking at how do you get more testing done in neighborhoods. And I know there are a lot of folks in a health equity task force that are working on thinking about how do you get more testing done in the neighborhoods, and then how do you partner with the FQHCs in neighborhoods, the health centers and the federally qualified health centers in neighborhoods that not only can identify if someone has COVID, but also can deal with some of the other challenges that people may not be aware of within their health, right? So I think there's a lot of things that can be layered upon. I think there's a new lens given to the health factors, but also the social determinants of health that impact people's lives.
So it sounds like we need to invest in structures change and in programs that can stabilize and uplift. What does that look like to you from like a practical standpoint? And how do you define that new normal for yourself?
Well, one, I think we're, even as we have an eye towards looking towards, as people would say, opening America back up, we're still in the throes of a challenge. Mm-hmm. We're still in the throes of a health challenge. We're still in the throes of an economic challenge. So there's the conversation of the immediate crisis as well as the recovery. And so what we've been really looking at doing, yesterday, actually, we announced some resources that we would like to divert to different things, because we've identified some of the largest challenges that we're finding are, renter assistance. We've identified challenges around mortgage assistance, homelessness, people not having enough to eat, even some spikes in things like domestic violence and partner violence when you're looking at the gendering of the pandemic that the Gender Equity Commission has been really working on. So we're really looking at what are these kind of things are immediate challenges, because those are the things that will still need resources. So within whatever context, the emergency resources that the city has to really help those kind of things through our URA and through our nonprofit partners, we felt that was really important. I know Chief Powell will also talk about some of the other things we've done around food and other partnerships. But, one, we do have people who are still in crisis. So as we look ahead, I think we cannot forget that people still have challenges, and there still are health challenges to be seen around this work. And so for me, the new normal is doubling down on what we've already been working on, acknowledging the partnerships that we can work together, where we can work together with partners, learning some of the best practices from, chief equity officers and government officials from across the country that really have been supportive of us and sharing information. So the new normal is, what does it look like to partner differently? How do we continue to break down the silos? How do we continue to put people at the center of things and not necessarily always personal or special interests or those kind of things, but actually what's going to get to people? And then, especially now more than ever, how do we mine out and kind of find what are those unique challenges? And we know that many of our partners on the ground are qualified to talk to us about some of those unique challenges.
Yeah, one of the things about crisis is that it can be clarifying in so many ways. Let's bring in Assistant Chief Lindsay Powell in. Lindsay, how are you doing today?
I'm all right. I think as Chief Lane and the mayor have said, I'm very grateful to be able to, shelter in place, but I have a lot of family and friends, as I'm sure a lot of people do, in some of those hotspot cities, New York, Seattle, and a lot of friends who are also essential workers. And so it's been a very scary time, but also I've been warmed by the outpouring of support and resources from the community. I'm on several threads online, as well as text chains about, hey, I've got a family in need of this, or do you think anyone can drive over these resources? And I've been impressed, and my heart's been warmed by the outpouring of folks who are just, ready to step in, ready to help, and want to be there to support, their fellow neighbors.
Thank you so much. You've been on the front lines in a lot of ways with working with different entities within city government. What can you tell us about how the city has marshaled and begun to distribute resources to our neighbors?
Yeah, absolutely. Our model has been from the very beginning, as again, Chief Lane and the mayor have said, how do we support the most vulnerable? We already know that our systems are incredibly fragile, and that those who have been marginalized or systemically or historically undervalued and oppressed, like those communities in particular, are feeling these shocks, incredibly hard. And so we've been trying through our services and partnering with organizations to provide support and resources for those who will be affected the most now, and also in the aftershocks of when we get back to this normal. I do want to thank and shout out some of our boards, authorities, and commissions who have been really helpful in helping us ensure that for these vulnerable communities, the people that they work with, the organizations that they partner with, their concerns that they're seeing on the ground are echoed and amplified up. And so thank you to our Gender Equity Commission that deals with issues surrounding women and girls, our Welcome to Pittsburgh Advisory Council that deals with new citizens, migrants, and refugees in Pittsburgh, as well as our LGBTQIA Advisory Council that deals with issues within that particular community. They've been great partners, and we've been trying to really keep our ear to those groups to ensure that we're able to echo and amplify the concerns that they have. In my mind, I try and bucket things, at least for this pandemic, in kind of three spaces: public health, accessible resources, and bolstering small businesses. And so within the public health world, we've been really trying to mitigate as best as we can how the virus is able to spread. So even before we mandated certain gatherings to be under a certain amount, and closing public spaces, the mayor and the administration had started from the very beginning. Again, even before we were told by the state level that we had to, starting to figure out how within our control within the city we're able to make sure that we're not doing anything to continue to spread. We've worked with our public safety department, the people within fire, police, EMS to enforce social distancing. There are units within the public safety department that have been critical in getting masks out to those who need it. And so we've been really trying to ensure, again, from our purview, that we're able to make sure that our public spaces are as safe as possible. From accessible resources, this is a place where we think where we've seen the great need to partner with some of the organizations across the city doing great work. Chief Lane had mentioned the URA, the Urban Redevelopment Authority, who've been at the forefront of ensuring that some of our residents who are renters as well as small business owners are supported. Even before the pandemic started, we had at the URA a rental gap assistance program. So essentially, residents, City of Pittsburgh, could call and say, hey, I've lost my job. This has happened in my life. I'm no longer able to pay my bills. And the URA would be able to get funds to that person immediately, even before a notice of eviction. And so we've been trying at the URA to fundraise to expand that program. And thank you to the mayor as well for allocating some federal dollars that we received to expand that program for renters to ensure that during these critical and scary times that folks are able to stay in their homes. We've partnered with Pittsburgh Public Schools in the school district to provide grab-and-go meals. So we're seeing, especially from all of our communities, that food insecurity is now a bigger problem more than ever for young people and students who have relied on getting meals from school, seniors who came to their local senior center to get meals. Those places are no longer operating in the way that they used to. So we've been partnering to make sure that we have grab-and-go meals. You can show up at a center Monday, Tuesday, and Friday, and throughout the city, and you'll be able to grab as many meals as you need until the next distribution for yourself and your families. We've also partnered with other organizations across the city when it comes to food insecurity, like Fallen to Food Rescue, the Food Bank, to ensure that in those hard-to-reach spaces, or where spaces we know folks are calling for distributions, we're able to activate very quickly to get food in the hands of those who need. The last little bucket I had was bolstering small businesses. This is going to be critical, when it comes to recovery and when we open up. We wanted to make sure as a city that we're able to support those businesses as best as we can, because we know they're what make Pittsburgh vibrant. They're what make Pittsburgh funky. And so we want to ensure that as we come out of this, that those businesses are able to be supported when we know the federal government and other pots of funding have been really hard for those businesses to get. So partnering with the URA, Neighborhood Allies, and others, we've been able to both provide technical assistance for small businesses to apply for those big grants, but also being grantors ourselves. And so the URA already has a microloan program for small businesses that they can apply to for up to $15,000, as well as other loan programs that they operate where, we've at the URA we've suspended our requirement to pay back those loans at the moment, as well as trying to bring more programs into, more businesses into our program to ensure that businesses across the city are all getting their needs met. And so it's been kind of all hands on deck across the city. We've known from, other crises that as a city, we have to collaborate, we have to work together. There's no way, as the mayor said, that the city itself can take care of all of these vulnerable populations. And so we've been trying to be as nimble and flexible as possible to meet the needs of those who are reaching out to us.
Thank you, Lindsay. I'll open it back up to everybody. You listening to each of you speak, you get a clear sense that not only this is an all hands on deck season, but just how diverse the stakeholders are in Pittsburgh and how many people are willing to lend a hand. Let's go to positivity for a quick second. What have you all been proud of as you look at our city and how our neighbors have responded?
Well, I'll start. Number one is that our neighbors have responded. We're not seeing that uptick in our poor neighborhoods or within our neighborhoods of color simply because people have been following the guidelines of the Center for Disease Control. We've also been very fortunate to see a much lower rate of infection than other areas of this country for that same reason. We're on the backside of the curve. There's all indications that over the course of the next 28 days, which is 2 life cycles of the virus, that we will see a continuation of the lessening of the amount of hospitalization and fatalities due to this virus. And that's simply due to the people of Pittsburgh and southwestern Pennsylvania.
I would just like to follow the mayor in saying that I think when looking at equity, it can be easy to ignore specific challenges when everyone is suffering. And so when you have a pandemic like this and everyone is impacted, it can be easy to minimize the communities that have traditionally been suffering and may be suffering more. And I think to that point, whether you're talking about government or you're talking about philanthropy or you're talking about the corporate community, an identification that equity and making sure that there are equitable outcomes for different communities is not a side table, that it's central to the table, that is central to the conversation. And I think that is unique for our area to really recognize that and put that first, and making sure that the resilience of our city is not imbalanced towards particular communities. I thought about the mayor's leadership around being identified as one of the 100 resilient cities from the Rockefeller Foundation some time ago, and that we were looking at shocks and stressors. And one of the ideas is, we talked about these stressors that were always there, and racism and sexism and poverty were these stressors. And then if you had a shock, what would happen? And now we're living through that actually happening, right? We're living through that. The shock was COVID-19, but the stressors were always present. And so one of the keys is, what does the resilience look like? How Pittsburgh is a resilient city. We've done it before. How we do it this time will be different, because now we have to make sure we include everybody in the improvement and in the change that we want to see. But I think we're really primed to do that, and our city government is primed to really think about resilience and sustainability as a lens and a way of living.
Mayor, any additional thoughts there?
No, I think Chief Lane hit it. This is an exercise that we began in 2015 through the Rockefeller Foundation. A lot of people questioned back then, what is resiliency? And I think that they sort of confused it directly with sustainability on the environment, which is a very, very big part of being resilient, but it's not the stand-alone part. We often think of those shocks that hit a city through man-made or natural disasters. But a pandemic is a shock. And when it does hit, it hits those communities that have been facing the continual stress over a long period of time the hardest. And let me just say this, that's not just in cities, and that's just not urban poor, that's rural poor as well. And that's the same type of disparities that you see when you go 50 miles outside of the city and you look at education systems. There's a very, very strong similarity in the issues that we face, especially in Appalachia and the Rust Belt, due to poverty. And so often we just look at the symptoms and we find the differences between urban and rural, when in fact the vast majority of those problems are the same.
Yeah, and I would just want to add very quickly that I think that if we're talking about positives from this pandemic, it shows us again how fragile these systems are. And so if you're talking about, all of the things that have arisen that we're seeing residents are critically concerned about, it's things that I think are often seen as like, it's good the way it is, we'll figure it out later. If you're talking about bridging the digital, like diminishing the digital divide, if you're talking about childcare, if you're talking about access to quality healthcare, these are things that we know are already, again, very fragile systems, but also we know that people of color within our communities are often adversely affected by not being able to access those things. And so within this pandemic, I'm hoping as we come out of it, we start to think again more critically about how these things are interconnected, about how, you know, getting kids a laptop at home isn't just, you know, oh, it's fun for the kids so they can play video games, whatever. It's critical to their learning. If you're talking about, you know, once we get out of this, like how critical healthcare is to folks, and how we need to do a better job of making sure that everyone has quality and accessible care. These are the conversations that I think folks are starting to understand. They're not just, you know, once we get everything done, these are the pie in the sky issues that we should deal with. These are everyday issues that are important to make sure that all of our residents are able to thrive and live their best lives.
Yes, fundamental to people's experience and how they're able to navigate systems and their ability to thrive. And Mayor, you mentioned this idea of shocks to the system, and of course the shocks permeate through down to the individual level. What is the role here for mental and emotional health from your all's perspective as our neighbors navigate this new reality as we build toward the new normal?
It's critical, because it is in the same way that a city or a region can have an economic shock. Individuals who have faced trauma in their lives, have faced different types of events. This type of a change in lifestyle will bring all of that back. We've been talking quite a bit with mental health experts from AHN, and being able to realize on a grassroots level what is happening. One of the interesting points that they brought up was the policy when the governor made it of closing all the liquor stores to those that were facing alcohol addiction. It became basically an obstacle, not it didn't stop somebody from being able to get alcohol, but it became how were they able to do so. I think one of the reasons that the governor has then eased on that is the realization that that is a part of a community that is already in a crisis mode that is going into a higher crisis mode, and being able to I don't want to say provide it, but being able to have access to it has been able to help those that are on the front lines and providing help deal with one less problem. There isn't just one answer to mental health issues, just as there isn't one answer to physical health issues. It depends on the type of situation that people are experiencing. But in the discussions with mental health experts, we are seeing a very, very strong increase in anxiety and in depression. And that will manifest itself in many different ways. One of the ways that we see it through public safety, unfortunately, is through domestic violence and through child abuse. And child abuse hasn't gone down, though the number of cases are down and the number of calls are down. It's simply that the children aren't going to school where others are able to report it for a child who won't speak out. It's now happening behind a closed door. And the same thing with domestic violence. So this past week, we initiated a plan to fund all of those organizations that are working with addiction, those organizations that are working with mental health, those organizations that are working with domestic violence, those organizations that are working with child abuse. those organizations that are working with the homeless. And we put over $8 million into the umbrella organizations so that they can then work with the groups that they support in order to be able to help people directly in Pittsburgh.
Thank you, Mayor. It reminds me of something that our critical communities manager, Laura Dragowski, in the Office of Equity has taught me so much about, which is the principle and the philosophy behind harm reduction. And I think it's a great opportunity for folks to investigate what that means. I know you're going to have a conversation with her in the next one of these series, Mayor, that can probably drill down on some of that and the realities of the organizations that are serving folks in those buckets, so to speak, but also the realities of those neighbors as well. Before we move from this conversation around mental and emotional supports, I want to open it up to Majestic and Lindsay to speak with that equity lens. Specifically, when I think about My Brother's Keeper, focused on Black men and boys, what you would say to and for those neighbors in Pittsburgh as it relates to their own physical or mental and emotional health.
Yeah, and I think that's a really good point. And I think that one, you have to remove stigmas around mental and emotional health. And you have to acknowledge that it is normal. And I think right now what we're seeing in anxiety, what we're seeing with different people and their responses is a normal response to a global challenge. So one, to acknowledge that. Two, you've been doing really good in the My Brother's Keeper space around Mindfulness Mondays and really sharing those resources. When a lot of youth serving organizations have really moved to that. So we really salute a lot of youth serving organizations that have moved to it, because we know that in many of the situations that young people are struggling with, and many in the Black community are struggling with, is around, PTSD and that level of stress and that level of trauma. And when that trauma, when you interact with someone else that also was experiencing some of that trauma, then a lot of things can start to emerge. And that's been also some of the work that our GVI folks have been doing with public safety and Reverend Cornell Jones. So I want to give him a shout out, because even during this time, there's still stuff happening. There's still things happening from a public safety perspective, and they're still in the community, still engaging, still reducing violence, still diffusing conflict, and utilizing a lot of skills to do that. And part of that is they acknowledge the trauma and acknowledge some of the mental health challenges that folks are working with. So, I think it's really, again, how do you make sure that people have the lenses of understanding the complexities of what's happening? Government is supposed to provide these basic services, but as we look at the health, safety, and welfare of our citizens, we know that we have to have the lenses and have to have the view of other things that are happening with our citizens. And whether it's our boards and commissions, like Chief Powell said, who've been really great. We want to thank them for their insight, their feedback, their support, and sometimes them pushing us to do more. And that's really important. That's where we really get that lens to see what's happening, to try to minimize things as best we can.
Chief Powell, any thoughts from you on this subject?
Yeah, I think it's also important to recognize and remember that for a lot of these marginalized, vulnerable populations, that these kind of stresses, these concerns aren't new. So for some of our families in Pittsburgh, food insecurity isn't new. Trying to find stable jobs isn't new. And so I think it's just, obviously it's exacerbated by COVID, but I think it's also really important to recognize that for a lot of Pittsburghers, this isn't a new reality. Being able to, cobble together between several jobs and whatever else that you're working on, a life that's able to meet all of your needs, all of your family needs. A lot of folks every day, this is their reality. I want to say, though, that I'm proud of a lot of the organizations that have come out to extend some mental health resources, including Still Smiling, as well as others. I know we've put out, as the mayor's office, put out a post and would be happy to repost it in the comments about places you can go to get some mental health services if you're experiencing anxiety or what have you because of what's happening in the pandemic around us. But it's also important to remember that a lot of these communities, again, live with these stressors every day. I think it's just that more people are feeling it. And so, as the mayor and Chief Lane have said, making these resources more widely available, removing the stigma receiving those resources is critical to ensuring, again, that everyone and all of our residents are able to live a hopeful and stable life.
Thank you each for that. And we're bringing this conversation to a close. I appreciate each of you sharing about it, because I think it's just as practical as we can be down at the neighborhood level, down at the neighbor level, to talk about mental and emotional health. And the reality is that those realities are also physical realities. They're taking place in the brain. They're taking place within our bodies. I also want to underscore the salute that Majestic gave to our youth-facing organizations that have incorporated learning around mindfulness. I'm thinking of one mentoring program that I've been involved with through the YMCA that has gone as far as incorporating mindfulness practices at the beginning of sessions with the young people to introduce them to this as well. And Mayor, you'll remember, of course, having been some of the reason why the partnership with Headspace that the city of Pittsburgh has engaged with, an app that folks can freely download, where you can start to learn some of the neuroscience behind the realities of mindfulness, and also go through practices that can help you build that out over time. And of course, Carnegie Mellon and the University of Pittsburgh, there is just a wonderful fount of information coming from those universities around the realities of mindfulness from a neuroscience perspective. A lot of information for folks to learn more about their own selves, and it's practical because it can help you navigate day to day. I want to bring us a conversation to a close here. Mayor, I remember one time we were at a dinner back when that was something that one did, and you spoke about this idea of conferring compassion. So with that being the frame, I'd like for each of you to just give us some parting words of encouragement, and just any final thoughts you may have for the neighbors that are watching.
Sure. First, Josiah, thank you for putting this together. It's very timely, but during this crisis, it's also very necessary. When you spoke about mindfulness, I'd also like to remind all of our public safety personnel that Headspace is offering their app for free to any Pittsburgh public safety official. So our firefighters, our medics, our police officers, even those that work within animal rescue have the opportunity to take advantage of that app for free. I think that compassion is a word that gets used a lot, but it's very difficult to try to find its application. In times like this, people tend to look more towards themselves and being able to want to have the things that they had before. For some, it's a steady paycheck or a business that they've worked to build and watching it slowly fall apart. To others, it's a steady meal, or to some, it's the ability to go golf or to go to a restaurant. And when you put those at the front of a crisis that affects all of us, you lose compassion. Compassion is the understanding of your neighbor, of those that have less, those that would be ecstatic to have what you have right now, and to be able to put their needs together with your own. So as we're tempted to look at this crisis as tyranny of government telling me what I can and cannot do, realize that we work for a greater good as well. That's the community that we call home. Unfortunately, we live in a city like Pittsburgh where most people understand that, and they go beyond that, and they volunteer to do even more. That's where you find compassion. Compassion is a term which deals with a sense, but it is best seen through action.
Thank you, Mayor. Deputy Chief Majestic.
Yeah, just want to kind of end and part with a couple of things. I mean, we know that the challenges are many, but I think there's, again, there are people who have been sounding the bugle call, and I think institutions have been responding to that call, and institutions have been responding to the humanism that we need so much right now. So again, I just really want to kind of send salute, if you will, to our authorities and institutions, like PWSA with extending the moratorium on water, the URA with reducing their fees, getting money out the door faster, the Housing Authority, putting a moratorium on evictions and all but the worst, most challenging cases. I mean, these are the type of things that we're seeing the responses to it. And this is the way that government is responding in a very unique way. Often social services and philanthropy and folks are able to be really responsive, but government seems to be behind in that. But I would say city government has been really, and supporting departments and authorities has really been on top of being human-centered for all in this crisis and acknowledging the challenges that people have. Also want to say that as an Office of Equity, we're not going through this alone. We have a partnership with organizations, cities across the country, but also organizations like Living Cities, like Policy Link and GARE, who really are bringing folks together in cohorts to really share information. And we're getting information from folks across the country on how they're dealing with these challenges of equity. And you'll see more out of that. And then finally, just to folks who have been working on these kind of things and keeping, again, the people in front. So, I mean, you'll see a lot around health equity and our participation on task force around health equity, our partnerships and working with Partner for Work on workforce and the future of work in this city and economic development, things like that soon to come. So really just to say thank you to all the helpers. Thank you to folks who are putting people first. And thank you for those who are being the best neighbors and the best people they can be during this crisis, and hopefully during the recovery, and willfully during the recovery to ensure that Pittsburgh continues to be as resilient and sustainable going forward for all residents.
Thank you, sir. Assistant Chief Powell?
Absolutely. I mean, compassion at this point is showing up for your neighbors in whatever way, whatever capacity that you have, whether that's donating, whether that's volunteering, whether that's just sending out, good vibration, good energy out into the world. I think at this point, it's critical that we're able to stand together as neighbors to ensure that those most vulnerable amongst us are supported now. And as Chief Lane said, throughout the recovery process, where once we open up, it's not going to be, shut the lights on and everything's back to normal. We have a completely different new normal, and I think an opportunity to really address, again, some of those inequalities that we've accepted as normal. And so compassion, again, would be ensuring that we keep this in mind as we start to rebuild and create what normal looks like going forward.
Well, I want to thank each of you for your time and participation, the generosity of your perspective and encouragement for us in this time. I'm certainly grateful to be working alongside each of you in this season. Just a couple final housekeeping items. First of all, this is the beginning of an ongoing series. The next will be on Tuesday, May 5th, where the mayor will discuss critical communities in and after the pandemic with Deputy Chief Majestic and Office of Equity Critical Communities Manager Laura Dragowski. There will be another one the following Thursday with our Welcoming Pittsburgh neighbors. That's supports and parts of the mayor's office that serves our immigrant refugee neighbors, newcomers, new neighbors to the region. Our team has been putting links in the broadcast of resources, places to get additional information, to find out about other opportunities. So please take a look there. We will also be at your disposal to try to answer any of the unanswered questions as time goes on. I just hope that it's clear for those that are watching that our leaders are behind you and they're working, for you and are rooting for you. And that as we move through this and build that new Pittsburgh and build that new reality, that you have dedicated, compassionate, hard-working leaders that are right alongside you. So anyways, thank you all for your time, and please take the very best of care, and we'll see you next time.